Hello, everybody. I hope that you're well. I know it's been quite a while since I have posted a video on this channel, and I just wanted to apologize. I've had quite a rough time of it lately, pain-wise, and dealing with some mental health stuff, so it's been trying to say the least, and I apologize profusely to all my fellow friends that are on this channel making videos that are putting in the effort every week to do it, and also to all of you out there because I know that you look forward to our videos and I haven't posted anything. So anyway, this week we are talking about PoTS and or dysautonomia, same thing basically. POTS, postural orthostatic tachycardia syndrome, is a form of dysautonomia. And I'll explain it to you the way that I explain it to like my family or friends that are curious about what POTS is. So basically, our collagen is all stretchy. Um, a normal person's collagen is tightly wound. Our collagen is more like this. It's more like an open knit. Um, I put it like this. Normal person's collagen is a pair of nylons. Our collagen is a pair of fishnet pantyhose. So the collagen is stretchy. Everything in our body has collagen in it. Skin, organs, joints, everything, including blood vessels. So nothing works right, including our blood vessels. So blood vessels are meant to pump your blood through your body, getting your oxygen to your brain, getting blood to your heart, everything. Our, when I say our, I mean people with EDS and POTS. Our collagen doesn't allow our blood vessels to work properly. So instead of being able to squeeze very tightly when we stand up or just even sit up, they just kind of squeeze very loosely. Well, a tight squeeze, let's see, I'm get backwards on my camera, sorry. A tight squeeze pushes blood up through it and blood goes through and, can circulate through your body. A loose squeeze pushes very little blood through. So our blood is not moving around like it should be. Um, that means that we get pooling. They call it venous pooling, and it's pooling in our limbs. So in our like forearms and hands and our calves down to our feet, we get blood pooling, which actually creates, you would think blood's there so it's warm, but it actually makes it cold because the blood is not circulating the way that it needs to. So we oftentimes have cold hands and cold feet. When blood is not moving around our body enough, our brain is not getting enough oxygen. So we become very lightheaded, dizzy, um, we become tachycardic because our heart starts freaking out, going, oh my gosh, what's going on? We're not getting blood where we need to. So it starts beating out of control really, really fast. Sometimes it's so fast I can look down at my chest. I literally see my chest moving like this. It's a very, very strange thing when I show people. Um, and so the heart's going crazy, which is where you get the tachycardia part of it. The orthostatic, which it's now changed, it's just postural tachycardia syndrome, but the orthostatic and postural basically are redundant, so they've kind of changed the name of it. Now it's just postural tachycardia syndrome. Makes way more sense. So anyway, postural meaning you stand up or, sit up or whatever. You go from a laying down position to a standing up position. So every single time that we stand up, we get these horrible sensations. Our heart goes crazy. It makes us very, very exhausted. It feels like our heart is running a marathon because our heart is basically running a marathon. It's going just as crazy as if we were actually running a marathon. So I always liken it to being a marathon runner collapsing at the end of the finish line, except for all I did was stand up. Lightheadedness definitely is a thing, but it can lead to even passing out, and passing out can be very, very dangerous. You stand up and boom, you fall down and hit the ground. When I was diagnosed with PoTS, it was in 2008. So I was in my mid to late 20s. Um, I I was just having all of these issues. I knew what POTS was. I knew that that's probably what I had, but I wanted to get a confirmation. So they did a tilt table test. And what that does is, so there's a bed, basically. Here's the person. So you lay on this bed. The bed goes like this and basically stands you up as not quite all the way up, but it stands you up almost all the way up. There's like, I don't know. You're at like, I don't know what degree. Somewhere between almost standing up and not quite standing up. So anyway, they hook you up with electrodes. They're following, they're running all their tests. They're checking your heart rate. They're checking your temperature. You're sweating because you start to sweat really profusely. They're watching you because you'll show signs in your face, like you start to kind of get out of it. Your speech gets slurred. So basically, it took me 10 minutes of just standing up. So if I were to stand in the same position for 10 minutes, I could probably repeat exactly what happened at the test. So I stood up for 10 minutes. My blood pressure went down to 50 over 33, which is extremely dangerously low. And my heart rate went all the way up to 170, and I passed out. So then they lowered the table, they injected me with something to bring me back, and that concluded the test. Basically, it showed, yes, I was definitely positive for dysautonomia. I had POTS, and sometimes doctors call it orthostatic hypotension because they don't actually want to label it POTS if they don't know enough about POTS, but I definitely have POTS. So still some of my doctors, even though I tell them that I have a POTS diagnosis, they'll write on my paperwork orthostatic hypotension. So if you hear that term, that's pretty much the same thing. You become hypotensive when you stand up. So anyway, after that, they started trying different medicines. Midodrine is a pretty standard one that they try. Midodrine helped me at first, and then it didn't help me so much, and I didn't like the side effects from it. It's been so long since I took it, and I don't remember what the side effects were, but I wasn't really liking it. Florinef, on the other hand, if they give you enough of it, actually does seem to help. What it is it's a steroid that helps you maintain your salt levels. Salt thickens the blood. So if you imagine your blood is thicker and your blood vessels are squeezing, they don't have to squeeze tight as tight as they would normally to get the blood moving up because the blood is more jelly-like. So anyway, Florinef is a great thing that's helped me tremendously. I'm also on propranolol, which is a beta blocker. We're not sure if that's working or not, so we may take me off of it. The thing that's helped me, I would say the combination that's helped me the most is the Florinef, along with lots of fluids and lots of salt, and my port. I will just show you what that is. So here I have this thing that goes, basically, it's a line, kind of like an IV, that goes directly into a vein that goes directly into my heart. And the catheter that's in there goes all the way down right into my heart. So it's basically an open well, it's not open, it's a needle that goes into this little portacath, and that provides access like through this thing, kind of like what's at the end of an IV line. And I hook up tubing to a bag of fluids, and it basically it inundates my body with a ton of fluids, and it tricks my body into thinking that there is greater blood volume because this is going directly into my veins, directly into my heart, which is going directly into my veins. So it's making um, them fuller, more, more full. So basically tricking my body into thinking that there's more blood in it, so it's easier for it to maintain regular, normal motions. Um, that has been the greatest help I think that I've received so far. It took a lot of work to get my doctors to be on board with this. On my blog, I will be posting about it. I have posted a little bit about the beginning stages of going through and trying to get approval for it. I have yet to post anything on the port itself and how it's helped me, but I will definitely do that in the future. So check my blog definitely for information on that. Um, it's it's a surgery, so they go in and they put you out basically. They open you up with a little tiny incision. They stick the thing in. They feed the line into the vein that goes right into your heart, and they stitch you back up, and that's it. And then when when I don't have it accessed means that there's a needle in it. When I don't have it accessed, it's just this little cylinder that's underneath my skin. Um, when it's accessed, which is accessed every day, I get it changed once a week, but I keep mine accessed 7 days a week. When it's accessed, it looks like this with the big bandage around it. That is just the needle, and it feeds right down into this. My fluids are not saline. I started out with saline. Saline's just salt water. Saline helps, and the idea of more salt makes your blood thicker. But we switched up to basically Gatorade in a bag. It's this wonderful thing called lactated ringers. It's a great mix of all these goodies like potassium and um, lac lactose and lactated something or other. I'm totally drawing a blank. Brain fog. EDS, yay. So but it's not milk. It's like lactic acid, like your body builds up lactic acid. I don't know. Something to do with lactose. Total brain fog. Um, I will try and figure out what is in it so that I can give you a list of that. Actually, I'll put that on my blog. On my blog post. But anyway, so it's this great mix. It's basically Gatorade in a bag, and it's what they give you if you go to the emergency room usually. So if you get fluids at the emergency room, it's usually lactated ringers, or if you have surgery, after surgery, you're usually hooked up to a drip, and that's usually lactated ringers as well. They use it pretty much standard instead of saline these days, just because it's so much better. Anyway, that was even better. It's like drinking Gatorade, but a lot of it and not all the bad stuff. So I guess it's more like drinking coconut water, except for it has extra goodies that coconut water doesn't have. So it's wonderful. Anyway, that is my story about PoTS and my treatment for it. And I will post more stuff on my blog, and I hope that answered some of your questions. If you have more questions, please, please, please leave them below. I will do my best to be back every week now, starting this week, so I will follow up and answer all of your questions at next week's Q&A. And I love you guys. Thank you for watching, and I hope that you are feeling well enough to get through this rest of this weekend and have a great, great week ahead. And I will talk to you guys next week. Okay, bye.